So, hello, doctors. Thank you very much for joining the MedCognito or receiving this email. I hope your studies is going well. I want us to now get into a very important subject and discuss a very key objective. So I'm going to share my screen and then we get into the discussion right away. So we're still doing our MCCQE1 objectives, and I'm sending this to you just, to review this very important topic because it's not an out and out, you know, medical issue like diabetes, hypertension, or, gallbladder disease, but very important. It is objective 114, 3, and it's intimate partner abuse and adult abuse. But today I'm going to focus on intimate partner abuse and violence. So, as usual, I need your attention, all your attention, okay? It's going to be straightforward, short, the most important things you need to know so that you don't beat around the bush. So put off your YouTube, get out all the distractions. You can replay this video over and over and over again. Basically, I need your full attention. So in order to ace this particular objective, you've got to make sure that all aspects of the topic are covered. Of course, this video is very short, so I can't cover everything, but I'm going to cover a good chunk of it so that you will know how to prepare for it, okay? So number one, you've got to review the risk factors for adult and intimate partner abuse, as well as the signs which indicate abuse, things like the clinical features of abuse and the consequences of abuse, as well as how do you screen for abuse, management of abuse. Are you going to report the abuse or not to report? Under what circumstance are you going to do that? And disposition and follow-up. These are the pillars of your learning for this particular subject. And so until you've reviewed every single one of them, you've not completed this particular subject. So let's get into some of these topics right away. So the causal conditions of intimate partner violence can be so many, but you can look at them from very critical perspectives. For example, physical abuse, psychological abuse, and that can be direct psychological abuse or, neglect, psychological neglect, emotional abuse, social isolation, sexual abuse, and economic abuse. So these are the types of adult abuse or intimate partner violence, okay? It can come in all these forms. Now, in reviewing a key objective for this particular video, what we're going to deal with is to list and interpret critical clinical findings, including those based on the identification of possible factors, putting the patient at increased risk of abuse. For example, what are the things which predispose this patient to abuse? Because you're expected to know that, okay? So the risk factors for intimate partner violence are female sex, age between 20 and 24 years. So that is a young age. Low income level of the household. Okay, so maybe poor socioeconomic status, you can state it that way as well. An unstable relationship, as well as somebody who is resident in a residential housing, or sexual and or physical abuse during childhood and adolescence. And this can be for the perpetrator or the abused, okay? And low academic achievement or low IQ, and drug or alcohol use disorder, as well as unplanned pregnancy and social isolation. So these are the key things you need to know as risk factors. So look, if I were you, I'll just pause this video and just take my pen and just write them down, and make sure that I memorize them. I memorize them. I can be able to regurgitate them, all these things, because it can come, as an MCQ, as a CDM, you may have to fill it in, or you may have to choose the best answer. So please, since it's a major objective, deal with it. Now, what are the signs of abuse? The signs of abuse. So one key thing is injuries which are characteristic of abuse. So if the patient comes and you're doing a physical exam and you realize, fingernail scratches, broken fingernails, bite marks, dental injuries, cigarette burns, bruises suggesting strangulation, or restraint, rope burns or ligature marks, it should go into your mind. This patient, is she being abused? Is this patient getting intimate violence, like intimate partner violence? Then you can also realize some injuries which are suggestive of a defensive posture. So, for example, if the partner is maybe about to throw the hand and the patient goes this way, these are injuries which are suggestive of a defensive posture. So forearm bruises or fractures may be sustained when individuals try to fend off blows to the face. So like this, okay? They try to prevent it. And then injuries during pregnancy. And in fact, I won't say this, you've got to suspect intimate partner violence in any pregnant woman with injury and inquire about it. So if the patient comes and broke the arm and the patient is pregnant, think about intimate partner violence as one of your differentials. It may or may not be, but think about it, okay? And these injuries can lead to preterm labor, placental abruption, direct fetal injury, maybe the baby, the patient's abdomen was stamped or something, stillbirth in the baby as well. And then you've got to look at injuries which have a central pattern. So injuries around the head, the neck, the face, the thorax, the abdomen. These are all indications or patterns of injuries in intimate partner violence. And you've got to look at the extent of the injury. It's inconsistent to the patient's explanation because the patient may be afraid, to tell you about it. So the patient is saying, oh, I was just on my bed and I was stepping down and this is what happened. And yet you look at it and it's a femur fracture. Come on. Femur fractures don't happen like that. You need to have a very big impact to have a femur fracture. So as soon as the patient starts describing stuff which are not consistent with your medical knowledge about how that injury occurred, think about intimate partner violence. And then patients may be embarrassed and they may not want to keep an eye contact and they may be keeping their head down, especially if the perpetrator is in the room. So you've got to, what do I do? Do I tell the partner to go away, especially when you are thinking that it's intimate partner violence? And you're going to need this information as well, even when you're preparing for your NACOSK exam. Okay. So that's something you want to pay attention to. And multiple injuries in various stages of healing. Very critical, very critical. So that tells you that maybe this abuse has been going on for some time. And the patient may say, oh, I'm just clumsy, or it's just a minor accident, or if the patient's partner who is abusing her, or maybe even, let me say, him as well in the room, you realize that they'll come in, oh no, she's just clumsy and all that. As a doctor, pay attention, and more especially because you're preparing for a board exam, pay attention. And if there's delay between the time of injury and the presentation for treatment, like the person is really injured, but the person tells you that, oh, it's happened 3 days ago. Why didn't you come? Why are you not in the ER? The patient may wait several days after the injury before seeking care. That's a big red flag. That's a big red flag, doctor. That's a big red flag. And whether it's in your NACOSK or in your QE1, intimate partner violence should be a key differential. And they may be considered as frequent flyers in the ER. So if you are reading your question stem, pay attention to some of these tips. Pay attention to them. And while you take your history, maybe if you get your psychological or psychiatric history, the patient may admit to a past history of suicidal attempt. What pushed the patient there? Inquire about intimate partner violence. So far you realize that out of those 8, I've reviewed the risk factors, the signs which indicate abuse, the clinical features of abuse, and some of the consequences of abuse, like the one in the pregnant patient, abruption, fetal demise, and even the attempt for suicide. So what I need you to do is just, pick your Tintinali as the reference material for emergencies and just review, screening for abuse and management of abuse, and are you going to report or not report? Under what circumstances? What do you do if there are children involved? And what will be your disposition? Are you going to keep the patient? Are you going to let the patient go home? And disposition, you must also have to think about, safety plan. But we can't cover all that in this particular quick, short review topic. So all the best in your exam as we do usually. Good luck, and when the exam time is up, go rock the exam. Keep a positive mind as always. Keep positive vibes, get friends and family who support you, and a positive life. And I hope to see you at the finish line. All the best in your exam preparation.